All right, question 5 on the review says the area of the respiratory system that would be affected by laryngitis is represented by what? Okay, well, laryngitis is affecting the larynx, which I know is in the upper respiratory tract. So it's definitely not C. C is deep down into the lungs. Okay, A is a nasal cavity. That's not, that would be sinusitis. B or D are likely the two answers that most people picked. How do we know if it's B or D? Well, the throat is higher up than the larynx. Your pharynx is where you swallow and breathe. It's up here, it's up in this part of your respiratory tract. Your larynx is at the opening of your trachea, which is this cartilage rings around this structure here. So the answer is B. D is not correct because it's pointing at your pharynx. Which of the following digestive system disorders can result from a high cholesterol content in bile? It's your gallstones. Which respiratory system disorder results in decreased surface area of alveoli? This happens with emphysema, and essentially your alveoli go from being a bunch of little tiny air sacs with lots of surface area. These kind of rupture, just like if you squished. Okay, so if you imagine like squishing a raspberry, you're going to end up with kind of a deflated thing that looks like this. The amount of surface area here versus here, this is way smaller. So you're going to be absorbing a lot less oxygen. That's why people with emphysema need to use oxygen tanks. Number 8, during inhalation, your diaphragm is contracted. Okay, when your diaphragm contracts, it lowers down. It gives your lungs more space. Okay, your intercostal muscles also contract. This then lifts your rib cage. So now your lungs, so if these are your lungs and this is your diaphragm when it's relaxed, okay, and your intercostal muscles are here, when everything contracts, it opens up, allowing your lungs more room. If it has more space, so if all of a sudden the air has more space, the pressure is going to be decreased because you're giving it more room. If we picture these to be the molecules of gas in your lungs, okay, now I suddenly spread them out and give them more room. There's less collisions between the molecules. The pressure is lower. Number 9, during inhalation, the concentration of oxygen in the lungs is higher relative to the oxygen in the blood. So by the time the blood circulates back to the lungs, it will have delivered most of that oxygen to your body cells, just like delivering mail. Last question. The movement of CO2 and O2 across capillary walls is passive. It moves by diffusion. Okay, so they naturally will move from a high concentration towards a lower concentration. When oxygen attaches to hemoglobin, it gives blood its red color. Okay, structure W is best described. Okay, here's structure W, and this is pointing at the alveoli, at the air sac. This is not a fluid-filled structure. That would be a problem if there was fluid in there. Okay, you wouldn't be able to breathe. It'd be like the equivalent of drowning. Site of gas exchange. This is true. Would it be affected by bronchitis? No. Bronchitis will affect a little farther up the respiratory tract. Capillary that carries blood? Well, part of this is a capillary, but the best answer is that this is a site of gas exchange. This is capillaries and alveoli. This is where gas exchange occurs.